Welcome to the Deep Dive. Today we're tackling something really common.
Definitely common.
And honestly, often pretty frustrating for us pet parents. Ear infections in our dogs and cats.
Absolutely, yeah.
Have you ever dealt with that constant head shaking, the scratching, or maybe that, well, not the pleasant smell?
You know exactly what we're talking about. It's one of the top reasons people bring their pets to the vet.
I bet.
Yeah.
Lots of listeners have probably been through it.
For sure. Or know someone who has.
Yeah.
So our goal today, our mission for this deep dive, is to really unpack these ear infections.
Okay.
We'll focus mainly on the outer ear ones. Vets call it otitis externa.
Otitis externa. Got it.
We want to make sense of, what causes them, what signs to look for, how your vet figures it all out, and the treatments.
And you mentioned maybe touching on the deeper stuff, too.
Yeah, briefly.
Yeah.
We'll touch on the middle and inner ear infections as well, otitis media and interna. We've sifted through a lot of veterinary info to hopefully give you a solid understanding.
Great. So where do we start? Maybe with the ear itself. It's not just the flap we see, is it?
Not at all. It helps to think of the ear in sort of three main sections.
Okay.
First up is the external ear. That includes the pinna, that's the visible flap everyone recognizes.
Floppy bit or the pointy?
Yeah, actually.
side.
And that funnels sound down into the ear canal. Now, this canal isn't just a straight tube.
Oh.
No, it's more like an L shape. There's a vertical part going down, and then it takes a turn horizontally towards the eardrum.
Okay. That L shape is important, I imagine.
It is. And that horizontal canal ends at the eardrum, the tympanic membrane. That's the boundary to the next section.
Right, the eardrum. So what's behind door number 2, behind the eardrum?
At the middle ear, it's a small space, normally filled with air.
Here, okay.
And inside are these tiny little bones, you might have heard of them, the ossicles. They're essential for transmitting sound vibrations.
Oh.
The middle ear also contains a bony cavity called the bulla, and the auditory tube, also known as the eustachian tube, which connects to the back of the throat.
Okay, external middle, what's the deepest part?
That's the inner ear. This is where the real processing happens.
The complex bit.
Yeah. You've got the cochlea, which is for hearing, and the semicircular canals, which are crucial for balance.
Balance. That's why inner ear problems can make them dizzy.
Precisely. And there are important nerves running through or near the inner ear, too, like cranial nerves 7 and 8, controlling facial muscles and hearing balance signals to the brain.
Okay, that gives us a good map of the territory. So let's zoom back out to what you said is most common. Otitis externa, the outer ear issues.
Exactly. Otitis externa just means inflammation of that external ear canal we talked about, the vertical and horizontal parts.
So it's red, maybe swollen, irritated.
Yep. But it's really important to grasp this. Otitis externa isn't the actual diagnosis of the cause.
Right, it's a description.
It's a description of the clinical signs, yeah. It tells us where the inflammation is happening, but not why.
Okay, that's a key distinction. So if it's just describing the what and where, what actually starts the fire? What are the underlying causes? You mentioned categories.
I did. Vets usually think about causes in 3 groups: predisposing, primary, and perpetuating factors.
Predisposing, primary, perpetuating.
Okay, think of it like this. Predisposing factors set the stage, primary factors light the match, and perpetuating factors keep the fire smoldering.
Gotcha. Let's start with setting the stage then. What are these predisposing factors?
So these are things that don't directly cause the infection themselves, but they make the ear canal environment more welcoming for problems.
Makes it easier for trouble starting.
Exactly. And a huge one is breed-related conformation, basically, the shape of the ear.
Like floppy ears.
Floppy ears are a classic example. Think spaniels, retrievers, hounds. Those pendulous ears cover the canal opening.
Less air gets in.
Right. It reduces airflow, traps moisture, creates a warm, humid environment inside. It's like a perfect little incubator for yeast and bacteria.
Oh, dear. So their cute ears can actually work against them?
In a way, yes. It's a major predisposing factor. Keeping those canals dry is key for these breeds.
What else about breed?
Some breeds have really hairy ear canals. Poodles, many terriers.
Yeah.
That hair can trap wax, dirt, and debris, and again, it cuts down on ventilation.
More trapped stuff.
Then you have breeds with naturally narrow ear canals, stenosis, we call it. Sherpays are often mentioned here. Narrower canal means higher humidity, harder for stuff to get out.
Yeah.
And some breeds, like Cocker Spaniels, Springers, Labs, they just seem to have more active ceruminous glands.
Those are the wax glands.
Yep. So they just naturally produce more earwax, leading to more potential buildup.
So genetics and ear shape play a big role in who's more likely to get these.
A very big role. But there are other predisposing factors too.
Like what?
Excessive moisture in general, not just from the ear shape.
Swimming.
Swimming is a big one, definitely. But also just living in a really humid climate. Or sometimes well-intentioned but maybe overzealous cleaning.
You can clean too much.
You can, or clean too aggressively, which can irritate the canal lining. We call that an iatrogenic factor, something caused by treatment or handling.
Huh.
This can also include reactions to certain ear cleaners or medications, or even trauma from, say, sticking cotton swabs too deep. Especially risky in cats, using cotton swabs like that.
Good to know.
Uh,
So ditch the cotton swabs for deep cleaning.
Please do. Even routine hair plucking from inside the ear canal, if done in a normal ear, can sometimes cause enough irritation to predispose it to infection.
Wow. Okay. Anything else predisposing?
Just briefly, underlying systemic diseases,
Okay.
things that affect the whole body can sometimes alter the skin's health or the immune response within the ear canal, making it more susceptible.
Right. So lots of ways the stage can be set. Now, what about the spark? The primary cause is what actually triggers the inflammation.
Okay, primary causes. These are the things that directly start the inflammatory process. Parasites are a really common one.
Like ear mites.
Ear mites, Otitis Externa, are top of the list, especially in cats.
Really? How common?
Some studies suggest they're involved in maybe up to 50% of Otitis Externa cases in cats. Less common in dogs, maybe 5–10%, but still significant.
Well, half of cat ear infections.
Yeah, they cause intense itching and irritation, and that often paves the way for secondary bacterial or yeast infections to jump in.
Nasty little things. Are there other parasites?
There are. Other mites like Sarcoptes, Nodries, Shillelagh can sometimes affect the ears. In certain areas like the southwestern U.S., there's a specific tick, the spinous ear tick, Otobius magnini. Even Demodex mites can occasionally play a role.
So parasites are definitely a key trigger. What else?
Hypersensitivity reactions, allergies, this is another major primary cause.
Like environmental allergies, pollen, dust mites.
Exactly. Atopy or environmental allergies is a big one. You might notice the ear problems are seasonal at first, maybe worse in spring or fall.
And food allergies.
Food allergies too, yes. Adverse food reactions can definitely manifest as ear infections. And interestingly, for some pets, recurrent ear infections might be the only sign of a food allergy.
Really? Just the ears?
It's reported quite often, especially in dogs with year-round itching, and in some cats too, so it's always something to consider in chronic cases.
Okay. Any other hypersensitivities?
Less commonly, maybe a contact allergy to something applied in the ear, or even systemic drug reactions.
Got it. Parasites, allergies.
Yeah.
What else starts it?
Foreign bodies. Things that just shouldn't be in there.
Like what? Grass seeds.
Grass seeds or plant-ons are notorious culprits, especially in dogs that run through fields. But it could also be clumps of dirt, dried medication, mat of hair, even a dead insect.
Yuck. And that would usually just be one ear, right?
Often, yes. Unilateral otitis often makes vets think about a foreign body first.
Makes sense. Keep going down the list of primary causes.
Okay, then we have autoimmune or immune-mediated diseases. Things like pemphigus foliaceus or lupus. Usually you'd see other skin lesions elsewhere on the body too, not just the ears.
More systemic issues again.
Right. Also, disorders of keratinization, how the skin produces and sheds cells, and some endocrine problems like hypothyroidism.
How do they cause it?
They can alter the production of skin oils, sebum, and wax, leading to a kind of greasy or waxy otitis. Again, usually there are other signs of the underlying disease present.
Okay. And one more.
Growths in the ear canal. Things like polyps, which are inflammatory growths or actual tumors. Polyps are a particularly common cause of recurrent otitis, especially in cats.
Polyps in cats. Okay. Wow, that's a lot of potential triggers.
It really is, and often it's not just one thing, but a combination of predisposing and primary factors.
Right. So we've set the stage, lit the match.
Yeah.
What about keeping the fire going, the perpetuating causes?
Ah, yes, the perpetuating factors. These are changes that happen within the ear because of the ongoing inflammation, and they make it really hard for the ear to heal even if the original trigger is gone.
So the inflammation causes more problems.
Exactly. Chronic inflammation itself is a major perpetuating factor. It causes the lining of the ear canal to thicken up. Yeah, it can develop folds and ridges, which makes cleaning much harder and creates little pockets where infection can hide. The skin itself, the epidermis, gets thicker.
Okay.
Those wax glands, the ceruminous glands, can enlarge and produce even more wax. Scar tissue or fibrosis can form, which actually narrows the ear canal.
Narrows it. That sounds bad.
It is. We call it stenosis. In really chronic, severe cases, the cartilage of the ear canal can even start to calcify, become hard and rigid instead of flexible.
Wow. Mineralizing almost.
Kind of, yeah. All this inflammation also disrupts the ear's natural self-cleaning mechanism, call it epithelial migration, so debris just builds up more easily.
So it can't clean itself out properly anymore.
Nope. And if the inflammation is severe enough to rupture the eardrum,
Then the infection gets into the middle ear.
precisely. And having otitis media, that middle ear infection, definitely perpetuates the otitis externa. It keeps feeding inflammation back into the outer canal.
Oh, and polyps can also develop as a result of chronic inflammation, further blocking things up.
So it really can become a vicious cycle. The ear gets so damaged by the inflammation that it can't heal properly.
That's a perfect way to put it. It gets locked into this cycle of inflammation and secondary infection.
Okay. So with all this going on, the inflammation, the potential infections, the debris, what are the signs we as owners should be watching for? What does otitis externa look like from the outside?
There are several classic signs. Head shaking is a big one.
Constant shaking.
Often, yeah.
Yeah.
Though, interestingly, if both ears are really painful, they might actually shake less vigorously, maybe just hold their head still.
Ah, okay. What else?
Scratching at the ears, rubbing their head on the carpet or furniture. Pain is a really important sign.
How do they show pain? They might yelp or pull away if you try to touch their head or ears. Some are reluctant to open their mouth wide, maybe because it stretches the ear canal area.
Okay, that makes sense.
A bad smell, a malodor coming from the ear is very common.
That distinctive ear infection smell.
Exactly. And then discharge. You might see gump coming out of the ear.
What kind of discharge?
It varies. It could be thick, yellowish tan, which often suggests yeast, or maybe darker brown or black, more liquidy, often seen with bacteria. But you can't rely solely on how it looks.
Need that microscope check.
Definitely. You'll also often see redness, erythema, and swelling of the ear flap, the pinna, and the opening to the canal. Itchiness or pruritus is almost always present to some degree.
All that scratching. Could it cause other problems?
It can. Sometimes the trauma from vigorous shaking or scratching can cause a blood vessel in the ear flap to break, leading to an oral hematoma.
That's the blood blister thing.
Yeah, the ear flap swells up like a pillow filled with blood. Needs veterinary attention.
Yikes. Any other signs?
They might just hold the affected ear flap down differently than the other one, or if it's just one ear, they might tilt their head towards the sore side.
A hip tilt.
And in some cases, especially if it's severe or chronic, or if the middle ear is involved, you might notice some degree of deafness.
Okay, those are definitely signals to call the vet. So let's say you do. You bring your dog or cat in, suspecting an ear infection. What happens next? What's the veterinary investigation look like?
Well, first, the vet will take a really thorough history.
Asking questions.
Lots of questions about the breed, age, previous ear problems, any known allergies, what you feed them, where they go, when the signs started, what you've tried already. All that background is crucial.
Okay, then the physical exam.
Yep, a general physical exam first, just to check overall health. But then the focus shifts to the ears.
The otoscope comes out.
The otoscope comes out. That's the handheld tool with the light and the magnifying lens and the little cone on the end.
Right.
The vet will use that to carefully look down into the ear canal. They'll assess the canal lining, look for debris, inflammation, foreign objects, growths, and importantly, try to visualize the eardrum.
Can they always see the eardrum?
Not always. Sometimes there's too much swelling or debris in the way. And if the ear is extremely painful, the pet might not tolerate the exam well.
So what do they do then?
They might need to give some pain relief or even mild sedation or anesthesia to allow for a complete and comfortable examination and cleaning. It's really important to get a good look.
Makes sense. Do they look at both ears?
Always, even if only one seems affected. It's good practice to examine the good ear first to avoid potentially transferring infection. And vets are usually careful about how they insert the otoscope cone to minimize discomfort.
Okay, so a good look inside is step one. What's next? You mentioned the microscope earlier.
Yes. Cytology. Taking a sample from the ear canal with a cotton swab, rolling it onto a microscope slide, staining it, and examining it under the microscope. This is arguably the most important diagnostic test for otitis externa.
Why is it so important?
Because it tells us what we're dealing with at a microbial level. Are there yeast organisms, like Malassezia? Are there bacteria? If so, what shape are they? Are they cocci, which are round?
Like staph or strep?
Potentially, yes. Staphylococcus, streptococcus, enterococcus are common cocci, or are they rods, which are oblong?
Like Pseudomonas.
Pseudomonas is a common rod, yes. Also, E. coli, Proteus. Knowing the type of bacteria helps guide the initial antibiotic choice. Cytology also shows us inflammatory cells, confirming there's active inflammation. And sometimes you can even spot mites on the slide.
So it gives you a snapshot of the infection.
A crucial snapshot. They'll usually take samples from both ears, as the infection might be different in each. Sometimes, if there's lots of waxy stuff, gently heating the slide helps the sample stick better for staining.
Okay. Cytology is key. What if the infection is really bad or keeps coming back?
That's when a culture and sensitivity test might be needed.
Sending a sample to the lab.
Exactly. This is especially common if cytology shows lots of rod-shaped bacteria, which can be trickier to treat, or if the infection isn't responding to the initial treatment.
And the lab tells you.
The lab identifies the specific species of bacteria, or sometimes yeast, growing, and then tests various antibiotics or antifungals against it to see which ones are most effective at killing it. That's the sensitivity part.
So you know exactly which drug should work best.
Ideally, yes. For really stubborn cases, or if middle ear infection is suspected, they might even take separate culture samples from different parts of the ear canal or from the middle ear itself, if possible.
Okay. Are there other tests sometimes needed? What about imaging?
Imaging can be useful, especially in chronic or complicated cases. Things like X-rays or more advanced imaging like CT scans or MRIs.
What are they looking for?
They can help evaluate how much chronic thickening or narrowing there is. Check if the middle ear structures, like the bulla, are affected, or look for masses like polyps or tumors that might be hidden deeper down. Standard X-rays of the bulla aren't super sensitive for detecting early middle ear infection, but they can show bony changes in long-standing cases. CT and MRI give much more detail.
Right. And what about allergies if they suspect that's the trigger?
If recurrent otitis is the problem, then allergy testing is often recommended. This might involve a strict dietary trial using a novel protein or hydrolyzed diet for 8-12 weeks to rule out food allergies.
A food trial.
Yep. Or intradermal skin testing or blood allergy testing, serology, might be done to identify environmental allergens.
Okay. Any other potential tests?
Well, if there are neurological signs like a head tilt or balance issues, a full neurological exam is crucial to assess for middle or inner ear disease.
Checking the nerve.
Right. Sometimes skin scrapings from the pinna might be done if they suspect surface mites. Rarely, a biopsy of the ear canal or pinna might be taken if they suspect something unusual, like an autoimmune disease or cancer.
And hearing tests.
A BAER test, brainstem auditory evoked response, can be used to objectively assess hearing, especially if middle or inner ear involvement is suspected or confirmed.
Wow. Lots of tools in the toolbox.
There are. And one more procedure worth mentioning is myringotomy.
Myringotomy.
If the vet suspects otitis media, but the eardrum is intact, they might perform a myringotomy. This involves making a tiny, sterile opening in the eardrum.
Making a hole in the eardrum. On purpose.
Carefully, yes. Using a needle or special catheter. It allows them to collect fluid from the middle ear for cytology and culture, and also to flush the middle ear cavity. But there is a risk of introducing infection from the outer ear, so it has to be done meticulously.
Okay, quite an involved investigation process for some cases. So once they have a diagnosis, or at least a good idea of what's going on from cytology, how do they actually treat these ear infections?
Treatment really focuses on a few key goals: removing the debris, killing the microbes, bacteria, yeast, mites, and reducing the inflammation.
Makes sense. How do they get the debris out?
Ear cleaning and flushing are absolutely fundamental. You have to get the gunk out.
Why is that so important?
For a couple of reasons. One, all that wax, pus, and debris can physically block medications from reaching the infected lining of the ear canal. Two, the debris itself can inactivate some medications or just provide a hiding place for the microbes.
So cleaning lets the medicine work.
Exactly. Vets will use specific ear cleaning solutions, often starting with something very gentle if the ear is sore. They might use a bulb syringe or a soft catheter attached to a syringe to gently flush the canal.
Does the owner usually do this at home?
Often, yes, but the initial thorough cleaning might need to be done by the vet, sometimes under sedation if it's very clogged or painful, especially if the middle ear needs flushing, either through a ruptured eardrum or via myronotomy. That's definitely a vet procedure. Then owners continue cleaning at home, usually less frequently as things improve.
Okay, clean the ear first, then the medication goes in.
Then the topical medications, yes. These are the ear drops or ointments applied directly into the canal.
What's in them?
They usually contain a combination of ingredients, an antibiotic to target bacteria.
Chosen based on cytology or culture?
Ideally, yes.
Mm-hmm.
Common ones include drugs like gentamicin, neomycin, polymyxin B, or newer fluoroquinolones like enrofloxacin or marbofloxacin, or perhaps fluorphenicol or silver sulfatazine. The vet chooses based on the likely bacteria. A very important note here. Some antibiotics can be toxic to the inner ear if the eardrum is ruptured, so the vet needs to know the status of the eardrum.
Good point. What else is in the drawer?
Usually an antifungal agent to treat yeast, most commonly Malassezia. Drugs like meconazole, clotrimazole, or nystatin are often included.
Okay, antibiotic, antifungal.
And almost always an anti-inflammatory, typically a corticosteroid.
Like cortisone.
Yes, drugs like dexamethasone, betamethasone, prednisolone, or triamcinolone, these are crucial for reducing the swelling, redness, pain, and itching associated with inflammation. Reducing inflammation also helps open up the canal and reduces glandular secretions. Sometimes a steroid might be used before cleaning to make it less painful.
So a combo product usually. What about mites?
If mites are the primary cause, then a parasiticide is needed. Some topical products contain ivermectin, selamectin, or moxidectin, which are effective against ear mites. Again, caution is needed with ivermectin in certain breeds sensitive to it. Sometimes systemic treatments are used for mites too.
Okay, so topical meds are the mainstay for otitis externa. What about pills or injections, systemic meds?
Systemic medications become more important in certain situations.
Like when?
For very severe, deep otitis externa, or if the vet suspects or confirms that the infection has spread to the middle ear, otitis media, or inner ear, otitis interna.
So deeper infections need systemic treatment.
Generally, yes. Oral or injectable antibiotics are often needed for otitis media interna, and the course can be quite long, sometimes 4 to 6 weeks, or even longer, because bone might be involved.
Wow, long time.
Yeah, and the choice of systemic antibiotics should ideally be based on culture and sensitivity results, especially for middle ear infections where things like Pseudomonas can be resistant. Drugs like cephalexin, clindamycin, amoxicillin clavulinate might be used, or sometimes stronger ones reserved for resistant bugs.
What about systemic antifungals?
Oral antifungals like ketoconazole or itraconazole are sometimes used alongside topical therapy for Malassezia otitis media, but their benefit for just otitis externa is more debated.
And systemic steroids.
Systemic corticosteroids might be used short-term in very severe, inflamed cases of otitis externa or media to quickly reduce swelling and discomfort, alongside other treatments.
Okay, so cleaning, topicals, sometimes systemics. What if none of that works? Or the ear is just too far gone?
That's when surgery comes into consideration.
Surgery for an ear infection.
It's usually reserved for end-stage ear disease, where the canal is irreversibly narrowed or even calcified, or for chronic otitis media that doesn't respond to medical management, or if there are tumors or polyps that need removal.
What kind of surgery?
There are a few procedures. A lateral ear resection opens up the side of the vertical canal to improve drainage and ventilation, but it doesn't address disease deeper down. The more definitive surgery for end-stage ears is a total ear canal ablation, or TECA.
Total ablation sounds drastic.
Yeah, it is. The surgeon removes the entire diseased vertical and horizontal ear canal. This is usually combined with a bulla osteotomy, TECA, where they open up and clean out the bony middle ear cavity, the bulla.
What's the outcome of a TECA?
It removes the source of chronic pain and infection, which can be life-changing for the pet. However, it does result in permanent deafness in that ear, as the structures for sound conduction are removed. So it's a salvage procedure, but often a very successful one for improving quality of life.
Right. A big decision. So let's say treatment is successful, the infection clears up. Is that the end of it?
Not necessarily, especially if there are underlying predisposing or primary factors. Preventing recurrence is key.
Maintenance.
Exactly. This often involves ongoing management. Regular, gentle ear cleaning at home, maybe weekly or every other week with a vet-approved maintenance cleaner, is often recommended.
Keep things clean.
Yeah. And crucially, identifying and managing any underlying primary cause is vital. If it's allergies, that needs long-term management. If it's hypothyroidism, that needs treatment.
Address the root cause.
Absolutely. Sometimes the vet might recommend periodic use of a topical product containing anti-inflammatory or antimicrobial agents as a preventive measure. And regular ear checks, both at home and by the vet, are important to catch any flare-ups early.
Okay, that makes sense for long-term success.
Yeah.
Now, you mentioned otitis media and intern earlier. Can we just briefly touch on those deeper infections again? How do they typically happen?
Sure. Otitis media, the middle ear infection, most commonly occurs as an extension of chronic or severe otitis externa.
Through a ruptured eardrum.
Usually, yes, the infection just spreads inwards. But it can happen even with an intact eardrum.
Uh-oh.
Sometimes inflammatory polyps originating in the middle ear or auditory tube can cause it. Or infection can ascend up the auditory tube from the throat area, maybe secondary to an upper respiratory infection. Less commonly, it could spread via the bloodstream.
And that special condition in calves.
Right, primary secretory otitis media, PSOM, in Cavalier King Charles Spaniels, where thick mucus fills the middle ear cavity, causing bulging of the eardrum and often pain or neurological signs.
What are the signs of otitis media generally?
Besides signs of otitis externa, if the eardrum is ruptured, you might see pain specifically when opening the mouth, possible deafness, maybe that bulging or opaque eardrum if it's intact. Sometimes neurological signs can occur if the infection affects nearby nerves, like facial nerve paralysis or Horner's syndrome.
Horner's.
That's a combination of a droopy eyelid, constricted pupil, and sunken appearance of the eye on the affected side. And Pseudomonas is a common bacterial culprit found in otitis media cultures.
And treatment involves?
Addressing the underlying cause, often long courses of systemic antibiotics based on culture, ear flushing if possible, gently, and sometimes surgery like that bulla osteotomy to drain and clean the middle ear. Vigorous flushing should be avoided if media or interna is suspected.
Okay. And otitis interna, the inner ear. That sounds even more serious.
It is because it directly affects the organs of hearing and balance and associated nerves.
How does that usually happen?
Most often, it's an extension of infection from the middle ear. Less commonly via the bloodstream or maybe from a tumor extending into the area.
And the signs are mainly neurological.
Yes, that's the key feature. You'll see signs of vestibular dysfunction, problems with balance.
Right.
Nystagmus, which is that rapid, involuntary eye flicking. A distinct head tilt, usually towards the affected side. Ataxia, so a wobbly, uncoordinated gait. They might circle towards the affected side. Nausea, vomiting, reluctance to move their head.
Poor things. Sounds awful.
It is distressing. You might also see facial nerve deficits, similar to otitis media weakness or paralysis of the eyelid, lip, nostril, maybe reduced tear production leading to dry eye, and potentially Horner's syndrome too.
And treatment for inner ear infection.
Again, long courses of systemic antibiotics are usually needed, often 6 to 8 weeks, as bone infection, osteomyelitis, is a concern. Medications for nausea and supportive care are important too. Thankfully, the vestibular signs often start to improve within days to weeks with appropriate treatment, although some residual head tilt can sometimes persist.
Well, that covers a huge amount of ground on ear infections, from the outer canal right down to the inner ear.
It really shows how interconnected it all is and how complex these seemingly simple ear infections can become.
Definitely. It's clear they aren't always straightforward, and often, like you said, there's an underlying reason they happen or keep coming back.
Exactly. And finding and managing that underlying cause is absolutely critical for long-term success and preventing recurrence. Simply treating the infection flare-up isn't enough if the trigger is still there.
Which leads us to, I think, the most important takeaway for everyone listening.
Absolutely.
If you see any of those signs we talked about, the head shaking, the scratching, that smell, any discharge, pain, please get your pet checked by your veterinarian.
Yes. Don't try to self-diagnose or just use leftover drops from last time or something you bought online.
Why is it so risky?
Because you might delay getting the correct diagnosis. You could be treating for yeast when it's bacteria, or vice versa. You might miss a foreign body or a polyp. And using the wrong medication, especially if the eardrum is ruptured, could potentially cause serious harm like deafness.
So seeing the vet is crucial for getting the right diagnosis and the right treatment plan tailored to your specific pet.
Couldn't have said it better myself. They have the tools and expertise to figure out what's really going on and how best to manage it.
So the advice is, be proactive. Know what your pet's ears normally look like and smell like. Do those regular checks at home. And don't hesitate. If something seems off, make that call to your vet.
Truly. Understanding even a bit more about how complex ear health can be really empowers you as the owner to be the best advocate for your furry friend's comfort and well-being.
A perfect final thought. On that note, we'll wrap up this deep dive into the world of pet ear infections. Thanks so much for joining us.
My pleasure.
And we'll catch you next time on The Deep Dive.